Hello and welcome to this podcast. My name is Mohammad Farooq Jabir, and in this podcast we'll be primarily discussing about principles of drug action. We'll be looking at the basic principles and the terminology involved in pharmacology. Drug interaction with the body can be divided in two classes, that is pharmacodynamics, that is the effect of the drug on the body, and pharmacokinetics, the effect that the body has on the drug, that is absorption, distribution, metabolism, and excretion. Chemicals or drugs that activate receptors and produce a response are called agonists, while antagonists combine with receptors but do not activate them. Antagonists reduce the probability of a transmitter substance, or agonists combining with the receptor and hence reduce or block its actions. Coming on to drug absorption. Drugs are absorbed from the GI tract, enter the portal circulation, and are metabolized as they pass through the liver. This is known as first pass metabolism, which we will discuss later on in a few slides. The route of the drug can be oral, IV, sublingual, rectal, and intradermal, intramuscular. If a drug is given by the IV route, it enters the bloodstream and is rapidly distributed to the tissues. The IV route is preferred when a rapid effect is required for continuous administration and the need for large volumes of drugs. And for drugs which can to prevent drugs which can cause local tissue damage if given via other routes, for instance chemotherapy. Renal excretion is ultimately responsible for eliminating most of the drugs, and drugs appear in the glomerular filtrate. Clearance is an important concept in pharmacokinetics. It is the volume of blood or plasma cleared of drug per unit time. Bioavailability is the term used to describe the proportion of administered drug reaching the systemic circulation. If a drug is given via the IV route, the bioavailability is 100%. But drugs given orally and the proportion of dose reaching the systemic circulation varies with the drug as well as from patient to patient. Transport systems are important mechanisms involved in distribution of the drug in the systemic circulation. The lipid cell membrane provides a barrier which prevents the transport of molecules into and out of the cell. And two important transport systems are ion channels and active transport processes. Ion channels are selective pores in the cell membrane that allow transfer of ions down an electrochemical gradient. In ion channels, the open or closed state of these channels is controlled via the membrane potential or a transmitter substance. Active transport processes are involved in the transfer of substances against their concentration gradients by utilizing special carrier molecules in the cell membrane, which requires energy. For instance, a sodium pump involves the expulsion of sodium ions from inside the cell by obtaining energy from ATP and involving the enzyme ATPase for the production of energy. Enzymes are important catalytic proteins that increase the rate of chemical reaction in the body, and certain drugs act on enzymes either by inhibiting or enhancing the action of enzymes. For instance, anticholinesterases that enhance the action of acetylcholine. Second messengers are chemicals present within the cell which increase due to receptor activation and bring about a cellular response. The most common second messenger is cyclic adenosine monophosphate, also known as CAMP. This second messenger is formed by utilizing ATP, that is energy, and the final production, that is CAMP, leads to a physiological effect within the cell. Drug metabolism is carried out by the liver. Drugs given orally are absorbed in the small intestines and enter the portal circulation travel to the liver where they are metabolized. This process is known as first pass metabolism. The drugs the function of the liver in drug metabolism is divided into two. That is, the drug is made more hydrophilic so that the elimination via the renal route is enhanced, and secondly, drugs which are usually less active are made more potent and are converted into active metabolites. Liver metabolism is primarily carried out via two reactions. Phase 1 reaction involves transforming the drug into a more polar metabolite by the process of commonly oxidation using cytochrome P450 enzymes present within the liver. And phase 2 reactions involves conjugation with an endogenous substance which helps with sort of readily excreting the endogenous substance via the kidneys. That's about it for this podcast. We've covered important topics of drug absorption, transport systems, and drug metabolism. Thank you and goodbye.